Hello, thank you for visiting my video, and I'm very happy that you have started looking at it. And I'm sure if you stay with me till the very end, you will have benefited immensely from what I'm going to tell you. I invite you to become a part of a very large economy that is called the dental health economy, which today is priced at $2 billion in the Indian market. Now, $2 billion is a lot of money, and in Indian terms, it is 15,000 crore rupees. So, how can you become a part of this economy? To understand that, let's see what is the position of dentistry today in the Indian market or in the Indian healthcare system. There are more than 300,000 dentists in India and more than 50,000 dental specialists in India. You heard me right. There are specialists, there are distinct specialities in India, and those specialists are almost about 50,000 in numbers. In addition to that, 300 dental colleges all over the country are adding 30,000 new graduates to the dental care economy. That is a very large number, and by the government figures, they want even more because they want to have a certain ratio of dentists to the population. Well, that's a different subject. So, what's happening in the dental market? Today, not many people, although there are so many dentists around, not many people really understand the scope of dentistry and what they are in a position to deliver. It is sad that not much effort is made by any agency, including the government agencies, to really take the benefits of good dental treatment to the huge public at large. We are a very large country and growing. We are getting very prosperous also. So prosperity also depends on you need with prosperity you get good health, and dental health cannot under any circumstances be neglected. Today, most people go to a dentist only when they are in severe trouble, that is in pain, and that's the only time they think of a dentist. And by that time, things are very late because a lot many procedures which could have taken place earlier are denied to the patient because the time is gone. There's a time for everything, and including good treatment and less, I mean, without much pain and less expense is possible only if and when patients visit the dentist regularly. It is advised that everybody sees a dentist at least once in 6 months to ascertain the status of the dental health. Here, what is recommended is that the dentist tries to find out what is going wrong with you and suggests appropriate treatment through the patient. Prevention is better than cure is best observed in dentistry, and that is one thing which you must take advantage of. Now, having said that, let me also tell you that dental education is very expensive, and so is the opening and starting of a dental clinic because there are a lot of gadgetry involved. There's a lot of machines and gadgets which are used by a dentist in regular practice, and they cost a lot of money. But in comparison to the investment made, the earnings are not as high as they're expected to be because of a lack of knowledge with the general public of what a dentist can actually deliver. So, here, what we really need is somebody to promote dental health care in the country with the public. So, what is happening in today's times? Most dentists can conduct or do conduct dental camps, especially at the time of their openings, and offer about 20% discounts to prospective patients on the work which is carried out by the dentist. But that doesn't go for very long because how many dental camps can you really conduct? As a matter of fact, it only happens in the beginning. Later, it is very difficult for people to conduct dental camps and do a follow up on the things. Also, the major source of dental health promotion or dental health care is done by our respected toothpaste companies who have really done a lot to bring up the standards of dental care in the country. But you see, they cannot be blamed because they only try to sell their products, which is absolutely fair. But dentistry is much, much more than just the brushing of teeth and the gargling of the mouth. There's a lot more to dentistry than that. And that part is unfortunately missed out. And they are not expected to do it anyway, they are doing their own stuff. Now, here is this is a situation or an opportunity for all those people, and there are a large number of people who feel that they need a supplemental income. That is, they are never happy with the amount of money they are making in whatever they are doing. Lots of people are unemployed, educated people are unemployed, and there are a lot of people who are doing chores but are dissatisfied with the amount of money they are making. This offers a great opportunity for people to train and step into this area as a dental health promoter. I request you to be with me till the very end to really understand what you can do and how much is the money involved. Now, today dentistry is not just pulling out of teeth and putting new teeth inside. There are lots of things happening which are aimed at trying to save your teeth and to give you a good situation where you can chew your food very well. Chewing is extremely important to the persons concerned because that's where your digestion or digestive process starts. Once the food is taken in the mouth, the food is chewed properly, and with the help of the tongue, it is mixed with the saliva in the mouth. And the first step towards digesting your food starts in the mouth. Now, if the food is not chewed properly, it is difficult to digest, and all the other things then start because nutrition is then a matter of concern. You're not getting good nutrition if you're not chewing your teeth. You're not chewing your food properly with bad teeth or missing teeth in your mouth. Now, to get you an idea of what really you can do, you have to become a dental health promoter, which is nothing but a bridge between the dentist and the general public. You have to attach yourself to a practice and form a bridge between the two entities. And of course, it is not doing a social service. You can earn as much as 20% of promotion fees for the recommendation that you make to the public for getting treatment with a dentist. Now, I told you the value of 15,000 crores is there at a time when people are not generally going to the dentist regularly. Now, if they were to go to the dentist regularly on a regular platform or a regular process, then the market is expected to rise 3 to 4 times to 45,000 crores to 60,000 crore rupees in almost about, say, 5 to 10 years' time. That's a lot of money. And if you position yourself as a good, reliable dental health promoter, you have a chance to make a large amount of money. Now, what is the costs involved of dental treatment today? A good dentist with a good amount of equipment and experience will charge you almost something about 30 to 35,000 rupees for an implant. A good specialist for braces would charge you anything from 2.5 to 3 lakhs to 50,000 rupees for straightening of your teeth. In case, depending upon what appliance that you choose and what system that you choose to work with. Now, even if you look at replacing the teeth, that is, implants are expensive, crowns and braces are expensive. The fillings are quite expensive, but if the fixed fillings are taken in good time, they serve out to be a very good process to save your teeth from bigger expensive procedures. But a root canal treatment can cost you anything up to 9 to 10,000 rupees depending on who is doing it and what is the extent of armamentarium the person possesses to conduct your procedure. Now, you will probably want to know who can join as a dental health promoter. Don't be surprised if I told you absolutely anybody can join. Anybody with any amount of education can join to be a dental health promoter. You will be working on your own time. There are no fixed hours. But mind you, you will not be paid a salary or you will not be provided with a place to sit and work from. This entire exercise will be totally performance based. The more you work, the more you promote, the dentist that you're attached to, the more you get a chance to earn money. And your money can be very substantial. And like I said, you could be doing just about anything. You require a few hours to do this. Or if you're not doing anything at all, you're just fresh into the market and you're looking for an occupation to start working with, this will be a great idea to become a dental health promoter. Now, how do you become one? You will be referred to a site, the dental www.dentalhealthpromoter.com, where you by stages you will be requested to make a payment of as little as 299 rupees to take the training program in Hindi or in English, whichever is your choice. Now, 299 rupees is really a very small amount to be entering into a market area which is 15,000 crore worth today and expected to go to 45,000 crore rupees to 60,000 crore rupees in a very short time. I'm sure people who go looking for jobs have spent more on application money, more spent on sending copies of their testimonials, or maybe you have spent more than that amount of money with astrologers trying to find out what's in store for you in the future. So I will request you to grab this opportunity with both hands. And once this thing catches on, it's going to be an exponential growth in this area. So who are going to be your employers? Your employers or your associates, you're not going to be employed. Let me make that thing very clear to you. Every dentist will welcome it because there's hardly a dentist around or very few dentists around who feel that they have enough work. Dentists generally always are available for doing more work provided they get the patients. And like I told you, for small works like pulling teeth out and all, yeah, okay, fine. But quality work demands a lot of time and its expense also is involved, and you get very good results with it also. So think about it, give grab this opportunity with both hands, and I wish you all the best in the brand new profession of a dental health promoter. Thank you very much for your time and patient listening.